Hello and welcome, everyone. Thank you so much for joining us for our Building Resilient Communities local strategies to combat the opioid crisis. We'll let folks get settled in and we will be starting momentarily. All right, I see a few people still joining us, but let's get started here. Again, thank you so much for joining us for our Building Resilient Communities local strategies to combat the opioid crisis with your presenter, Humberto Carvalho. The views expressed in this training are the views of the trainer and do not reflect the official position of DHHS or SAMHSA. A few housekeeping items for you all. If you are having any technical issues, please individually message me, Alyssa Koala, in the chat section, and I'd be happy to assist you. Any questions for the speaker, please use the Q&A section of your toolbar. At the end of the presentation today, we will take some time to answer those questions. You will be redirected to a very short survey at the end of today's presentation, and we would greatly appreciate it if you could fill that out. Certificates of attendance will be sent out via email to all who attend today's session in full. The recording and slides will be made available on the Great Lakes ATTC website by the end of the week. If you would like to stay connected with the Great Lakes ATTC, follow us on Facebook, check out our LinkedIn, YouTube channel, or our podcast channel. I'm super excited to hand this over to your presenter, Humberto. Thank you so much for being here with us today.
Thank you, and I am going to share my screen. Hold on a second. And I'm going to put it on presentation mode. Can you all see this?
Yes, we can see it.
All right, so thank you all for being here today. Like Alyssa said, our subject today is building resilient communities, local strategies to combat the opioid crisis. This is a pretty extent subject, but I'm going to try to summarize everything in about an hour to an hour and 10 minutes, and hopefully this will be some useful information that you can use to improve platforms for combating the opioid crisis in your community. Like Alyssa already said, all the views and opinions expressed in this presentation are from the author, who is myself, and it does not necessarily reflect those of any affiliated organizations. So the objectives for today's webinar is what we're going to do is we're going to look at some data to understand the current landscape of the opioid crisis in communities. We're also going to talk and discuss a little bit about effective community-driven strategies and programs, and also going to talk about some tools and resources to implement or enhance local initiatives. So we're going to start today by just talking a little bit about how to understand the opioid crisis. So the opioid crisis is actually the annual overdose deaths reached roughly about 105,000 in 2023, which included about 80,000 fatalities for overdoses, which was nearly 10 times the opioid deaths recorded in 1999. So also in terms of misuse prevalence, nearly 9 million people tends to misuse opioids annually. And there's a recent data from 2025 that actually shows that the most significant decline of overdose deaths in decades, so which offers us some caution and optimism. So to better understand the waves of the opioid crisis, I think this CDC chart shows it tells a great history of how the opioid overdose deaths, the waves of the overdose deaths. So the first wave actually happened around the 1990s, towards the end of the 1990s, with the rise in prescription opioid overdose deaths. Then there was a second wave, which was with the rise of heroin overdose deaths, which started around 2010. And there was a third wave, which was the rise of the synthetic opioid overdose deaths, which started around 2013. As you can see, there was a huge jump between the 2010 and 2013, and now 2023, which is the end point of the data here. So if you look at the opioid crisis today, the opioid involved overdose deaths, it has actually dropped from 83,000 in 2023 to about 54,743 in 2024, which is great. But, despite of this decline, it's still a very big problem, and remains among the overdose deaths still remain among the leading cause of death of Americans aged 18 and 44. Therefore, it is still a very, very big issue. Now, what are some socioeconomic and mental health factors that drive the vulnerability for individuals to actually, become addicted to opioids? You know, uh, so communities actually experiencing high rates of opioid misuse, they often face overlapping socioeconomic pressures and mental health challenges that actually increase their vulnerability. These factors don't act actually in isolation. Rather they actually compound each other, creating environments where substance use can become a coping mechanism or a symptom of deeper systematic issues. So, economic hardship and unemployment, as a source of instability. Economic instability is one of the strongest predictors of substance use vulnerability. If you think about job loss, wage stagnation, and unstable employment, all of this increases stress, reduce access to healthcare, and actually erode a sense of purpose. Communities with declining industries, especially in rural areas, where you have declining of manufacturing, mining, and even agriculture, they often experience chronic stress and social fragmentation, which increase risk for misuse. Also, individuals facing financial insecurities, they are much more likely to seek opioids prescribed or illicit as a way to manage the physical pain from labor-intensive jobs or mental stress. So another stressor is poverty and limited access to resource. Poverty increase risk through both environmental stresses and restricted support networks. So, for instance, limited access to quality healthcare, mental health services, insurance coverage, and transportation leads actually to untreated pain and untreated mental health conditions. Overburdened communities, like they may lack recreational space, youth programs, and protective social infrastructure, which makes substance use more accessible than healthy alternatives. Also, if you think about food insecurity, housing instability, and chronic stress, all of this further erode resilience. Another stressor is chronic pain and physically demanding work. In many regions, especially rural areas or even working class areas, there's a lot of people who have a lot of jobs that demand a lot of physical stress, which leads to acute injuries and chronic pain. Historically, this increased exposure to prescription opioids for pain management, and obviously without access to physical therapy or specialty care, individuals may rely on opioids longer than intended, raising the risk of dependency. In terms of co-occurring and mental health disorders as a distressing effect. So, mental health conditions significantly increase vulnerability to opioid misuse. Think about a depression, anxiety, PTSD, trauma histories, and unsolved grief. All of this often drive individuals towards opioid as a form of self-medication. And people with untreated mental health conditions, they're actually much more likely to experience cravings, dependence, and overdose. Also barriers to treatment, such as like cost, stigma, provider shortages, it translates into many individuals struggling without support. Another stressor is all trauma and adverse childhood experience. We call it ACEs. Exposure to trauma, especially, during childhood, has long-term impacts on brain development and stress regulation. So, for instance, high ACE scores, meaning individuals who suffer either abuse, neglect, parental substance use, household instability. These all strongly correlate with later substance use. And trauma survivors, they actually may use opioids to numb emotional pain or actually cope with stress, particularly in environments where therapeutic resources are limited. Another stressor is social isolation and a weak community networks. Strong social networks support protects actually against substance misuse, but many vulnerable communities actually experience the opposite. You know, Isolation, loneliness, the lack of connectiveness. These all increase susceptibility to addiction. Also, communities with high rates of mitigation out, aging population of migration out, like communities that are like losing a lot of people, they're moving out of their region, or they have like a lot of aging population or breakdown of traditional support systems, they are particularly at risk. And weak community ties can actually also impede recovery by limiting peer support and accountability. So another stressor is also limited education and health literacy. Lower educational attainment is actually associated with increased risk of misuse for several reasons. One, it reduces access to stable employment and insurance. Also, lower awareness of opioid risks, safe medication practices, and available treatment options. It also makes it more difficult navigating healthcare systems or advocating for alternative pain treatments. And finally, one of the most significant stresses, in my opinion, which is stigma and cultural barriers. In some communities, addiction is still viewed as a moral failing rather than a medical condition. This can actually discourage individuals from seeking early intervention and push substance use into secrecy, increasing overdose risk. Now, what makes a community resilient? Okay, so a resilient community is actually one that can anticipate, withstand, and recover from challenge, whether independently of the type of challenge, it can be economic, social, or health related. But while maintaining the well-being of its residents. In the context of opioid crisis, community resilience means having the structures, relationships, and resources necessary not only to respond to substance use issues, but actually to prevent them and support long-term recovery. So resilient communities share several key characteristics. One of them is they actually have strong social connection and support networks. They have close-knit neighborhoods, active community groups, and engaged families created to create a protective buffer against isolation and addiction. They have supportive social ties, that helps people recover faster, access resources, and feel a sense of belonging. And communities with strong social capital are actually better equipped to mobilize quickly in crisis. So, communities with resilience, they also have they promote access to comprehensive health and behavioral services. A resilient community ensures that residents can actually get the care they need. Accessible mental health service, substance use treatment, and recovery supports are essential. Integration of care, such as behavioral health embedded in primary care, all helps to catch issues early. Also, another strategies are telehealth, mobile clinics, and culturally responsive care, which reduce access barriers, especially in rural or underserved areas. So, in terms of economic stability and opportunities, economic well-being directly influences substance use vulnerability. So communities with job opportunities, stable housing, and affordable living conditions, they experience lower substance use risk. And workforce development programs and recovery-friendly workplace support sustained recovery and reintegration. So resilient communities, they actually have strong prevention and education systems. You know, resilient communities, they actually invest in upstream preventions, such as school providing social emotional learning, trauma-informed practice, and youth mentorship. Also, public education campaigns that helps to reduce stigma and increase awareness of risk and resources. You know, they have families and communities groups receiving training on recognizing early signs of substance use. They also have programs like naloxone distribution and and youth education, which drastically reduce overdose deaths. And they also have prevention strategies that meet people where they are and create pathways to treatment. So resilient communities have or promote rapid collaborative response systems. You know, uh, partners such as health departments, law enforcement, healthcare providers, social services, schools, recovery organizations, and faith groups. They all work as a coordinated network. Data sharing and early warning systems actually help detect trends and respond quickly. Quick response teams, they follow up after overdose to link the individuals to appropriate care. Also, resilient community, they actually promote trauma-informed community culture. Understand trauma is actually critical. Resilient communities recognize how trauma contributes to substance use and design systems that are actually non-judgmental, compassionate, and safe. And this actually includes training for educators, law enforcement, healthcare providers, and frontline staff. So resilience also means inclusive leadership and community empowerment. Resilient communities are built with and not for the people who live there. So then empowering leaders to engage, leaders engage residents in planning, in decision making, value lived experience, people in recovery, families affected by addiction is actually valued as a vital source of insight, and also having fairness, which is fairness is prioritized so that all populations benefit, including rural residents, communities of color, and low-income families. Lastly, resilient communities, they have strong recovery ecosystems. Resilience includes the ability to bounce forward, not just back. Having recovery housing, peer support networks, recovery community organizations, and supportive workplace strengthen long-term recovery outcomes. And communities actually celebrate recovery as a strength and a shared responsibility. So in summary, a community actually becomes resilient when they support strong relationships, when providers provide accessible services, when they ensure economic stability, when they invest in prevention, they work collaboratively, they understand trauma, they center lived experience, and they support long-term recovery. All these elements actually reduce vulnerability, promote well-being, and prepare communities to respond effectively to challenges like the opioid crisis. Now, what are some strategies that work? Well, I'm going to talk about several types of strategies here, which is, in the whole sense, is ideally a strategy that could be present in most communities, right? Obviously, several communities have issues and difficulty in implementing some of these challenges. But what I'm going to lay out here for you is just like, uh, different types of strategies that may be worked out when you're planning, to create initiatives that actually promote helping communities to deal with the opioid crisis. So the first set of strategies that I'm going to talk about are prevention initiatives. Prevention is essentially the foundation of a resilient community, a resilient community's response to the opioid crisis. Effective prevention focuses on addressing risk factors before substance misuse begins, especially among youth, families, and high-risk population. So the most successful initiative work across multiple settings, like schools, healthcare, workplaces, and neighborhoods. And combine several strategies such as education, support, early intervention, and community norms that actually promote health and resilience. So this table here shows several types of initiatives, the key components, and why it works. I'm just going to highlight the initiatives. For instance, school-based prevention programs, which why this initiative usually works because the students are equipped with coping skills, and they are far less likely to misuse substance. Also, family strengthening in parent-focused programs. Youth feels supported and becomes less likely to turn to substance during difficult times. That's why it works. So community awareness and anti-stigma campaigns, it works because it helps the community to be better in better awareness, increase the knowledge and understanding of the community. Also, early screening and interventions, which is very important because issues are addressed early. Safety prescribing and pain management practice, it works because fear and necessary prescriptions are issued. And also youth engagement in alternative pathways, which helps, engagement and builds identity, belonging, and hope. And the last one there is community environment and policy measures. It works because policy level prevention creates long-term change that reduce risks. So all these are preventive focus strategies that actually help a community to become resilient. A second strategy that works is expansion of treatment access. Effective treatment saves lives, as we all know, but many people struggling with like opioid use disorder. They face significant barriers, like from geographic barriers, cost to stigma, and also provider shortage. Expanding treatment access means creating multiple low barrier pathways so people can actually get help when they actually are ready to receive the help and where they are. So a resilient community actually ensures that evidence-based treatment is not only available, but accessible, equitable, and also responsive to the actual needs of the diverse population. So again, a table here with several treatment initiatives that you can actually deeper into these initiatives later. But I mean, one important initiative is increasing access to medication for opioid disorders, which reduce the risks of fatal overdose, relapse, and infectious disease transmission. Also, integration of behavioral health into primary care, which help patients, give patients, patients are more likely to engage with treatment when it's actually offered in a familiar, low stigma environment, which is a place that they're familiar with. Another initiative is like expanding telehealth and virtual treatment options, which actually reduce, transportation barriers, provide privacy, and expand reach. Another initiative is mobile treatment units and community-based clinics, which is, help meet people where they are. Another important initiative is like low barrier same day access treatment models. If people are more likely to accept help in moments of readiness. Another important initiative is embedding treatment in emergency departments. Emergency departments, emergency care departments or emergency care units, when they offer MOUD, is medication for opioid use disorder, when they do initiation in an emergency department, a lot of A lot of reports have shown that increased treatment engagement and reduced mortality in high-risk patients. Also, using culturally responsive treatment, you know, which it works because patient trust increases and engagement improves. And also strengthening like peer recovery support. Peer helps reduce stigma, build trust, and provide practical support, increasing treatment adherence. Now, another strategic strategy that actually works for creating resilient communities is cross-sector partnerships. The opioid crisis is actually too complex for any single organization or entity to handle it alone. So cross-sector partnerships actually bring together diverse systems, such as like healthcare, law enforcement, education, social service, community groups, and people with lived experience. To create a coordinated, unified response. When sectors collaborate intentionally, communities actually achieve faster and more sustainable progress in preventing overdose, also expanding treatment and supporting recovery. Cross-sector partnerships actually transform fragmented service into comprehensive networks of care. So here, an example. I'm going to give you a couple of examples of partnerships that are important when you think about creating resilience in a community. Partnerships between health and behavioral health collaboration. Health providers and behavioral health organizations, they often operate separately, which leads to like missed opportunities for prevention and interventions. So partnerships close these gaps. So key strategies for these partnerships are embedding behavioral health staff inside primary care offices or emergency departments. Also, shared care plans and coordinated follow-up for individuals at high risk overdose. Also cross-training clinicians in addiction medicine on addiction medicine, so trauma-informed care and prevention principles. So the benefit of this partnership is that you create a platform for early detection of substance use risk, also streamline referrals and improve community of care. Another important partnership is between public health and law enforcement. These two sectors, historically, they actually worked independently, but collaboration between these two sectors has actually become essential and more common over time. So some key strategies include post-overdose outreach teams, which are like quick response teams, working together. Also, data sharing agreements that track overdose spikes and guide rapid community response. Training law enforcement in de-escalation, naloxone use, and supportive engagement. And the benefit of this kind of partnerships falls on reduce repeat overdose, also increase linkage to care instead of incarceration, and faster identification of dangerous supply trends. So, it's very important partnership actually. Another important partnership is between education systems and youth service alignment. Schools and youth serving organizations, they're actually critical prevention partners. And key strategies include, schools collaborating with health departments and behavioral health agencies to provide social emotional learning, screening, and counseling. Also, training teachers to spot early behavior signs of substance misuse or trauma, and community youth coalitions involving schools, sport programs, and after-school organizations. The benefit of this collaboration falls on early intervention before issues escalate. Also, create strong protective factors for youth, and actually reduce stigma and greater awareness. Other very important partnership between community-based organizations and faith communities. Local organizations often they actually have deep trust within communities that the systems actually lack that type of trust sometimes. So, strategies include, partnering with faith leaders for outreach, education, and recovery support. Also, using community centers as hubs for naloxone training, support groups, or mobile treatment units, and also collaborating with nonprofits to address social determinants like housing, transportation, and food access. So the benefit of this partnership is, expanded reach to understand to underserved population, also increased community engagement, and greater cultural responsiveness. Another very important partnership between housing, employment, and social service agencies. Recovery is actually more successful when social needs of the population and the individuals are actually met. You know, Strategies that involve like housing agencies partnering with treatment providers to support people transition from detox or incarceration, or also workforce development programs collaborating with recovery organizations to create recovery-friendly workplaces. And also social services networks connecting clients to wraparound supports such as childcare, benefits, transportation, and vocational training. All this creates a set of benefits that usually, higher treatment retention, create improved long-term stability and recovery outcomes, and also reduce cycles of homelessness and incarceration. If you think about partnerships between criminal justice system and treatment providers, providing, actually many individuals with opioid use disorders, they intersect with the criminal justice system, making this like an essential partnership, actually. So strategy would involve providing medications for opioid use disorder in jails and prisons and ensuring continuity after release. Also, court-based programs like drug courts that offer treatment instead of traditional sentencing, and also reentry coalitions that provide peer support, housing support, and employment assistance for the individuals after release. So the benefits are this can cause dramatic reduction in post-release overdose, also better treatment engagement, and lower recidivism. Another very important partnerships with people with lived experience. Uh, Involving individuals in recovery actually transforms systems from the inside out, actually. Strategies include hiring peer recovery coaches across healthcare, social services, and law enforcement systems, and also including individuals with lived experience in planning councils, advisory boards, and decision making. Their perspective is actually incredibly important, and it's, taken seriously. It can actually make a lot of improvements in the delivery system. So using peers to actually lead community outreach and prevention education is also a very important strategy. Now, the benefits is that this cause creates a stronger trust and engagement, also helps to reduce stigma, and actually is a more person-centered service design. So another partnership to consider is data sharing and coordinated response networks. Collaborative data use strengthens community readiness and rapid intervention. So the key strategies is share dashboards on overdose, naloxone administrations, and also treatment availability. Also, creating overdose detection mapping systems that trigger alerts for sudden spikes, and creating collaborative evaluation to measure progress and refine strategies. So the benefits of this is that creates faster and more informed response, also better targeting of resource and stronger accountability and impact measurement. Now, in summary, cross-sector uh, cross-sector partnerships, they work because they break down silos, they share information and resource, they reduce duplication of effort, they create consistent pathways to prevention, treatment, and recovery, and they also align diverse organizations toward a common goal. Communities that form strong, intentional partnerships, they actually see significant improvements in overdose reduction, treatment access, and long-term recovery outcomes. So the last strategy that works there I want to touch is supporting long-term recovery. So recovery from opioid use disorder is actually not a single event. It's actually a long-term, non-linear process that involves healing, rebuilding, and reclaiming life. So communities that prioritize long-term recovery support reduce relapse rates, they actually strengthen family ties, and they help individuals reintegrate as healthy, contributing members of a society. So sustainable recovery actually requires ongoing support, not just initial treatment. So let's talk about recovery housing and safe living environments. Stable housing is actually one of the stronger predictors of successful long-term recovery. Key strategies include expanding access to recovery residences, sober living homes, and actually transitional housing. Offering rent-free or housing vouchers for people living treatment, incarceration, or homelessness. Also ensuring recovery housing follows quality standards, peer support, safety policies, community engagement. Why does that work? A safe, substance use free environment actually allows individuals to focus on healing, also think about employment and reconnect with their community without the triggers of or the instability that can lead to relapse. So investing in peer recovery support services. Peers, the individuals with the experience, it actually serve as mentors, advocates, and actually role models. So the key strategy is embedding peer recovery coaches in hospitals, treatment centers, courts, and actual community agencies. Funding peer-run recovery community organizations, and also offering ongoing coaching, check-ins, crisis support, and navigation through complex systems. This strategy works because peers, they build trust, they reduce stigma, and they actually help individuals stay engaged in care long after formal treatment ends. Also, supporting recovery community center and support networks. Recovery thrives in connection, not in isolation. And the key strategies for this is actually creating community centers that actually offer mutual aid meetings, skill training, social activities, and resource navigation. Also supporting groups like NA, Smart Recovery, Celebrate Recovery, and culturally specific peer networks. So also designing events that and activities that actually celebrate recovery and create positive social alternatives. This strategy works because connection actually reduces loneliness, builds resilience, and actually helps individuals form new and substance free social circles, so they are not involved in an environment where they will be prone to relapse. Another strategy is investing in employment and workforce development. Employment is actually a critical factor in long-term stability and self-worth. So partnering with employers to create recovery-friendly workplace or job training programs tailored to creating job training programs tailored to people in recovery, also resume workshops, financial literacy training, and employment coaching, and also removing barriers such as lack of ID, criminal record challenge, and actual transportation. This type of strategy usually works because employment actually gives people purpose, stability, and confidence, which are key components for sustaining recovery. So another strategy is focusing on continuing care and ongoing clinical support. Recovery, as we know, is more successful when individuals have access to long-term clinical resource. Key strategies would include like regular check-ins with counselors and clinicians post-treatment, maintenance of medication for opioid use disorders as needed. Also, outpatient therapy, mental health counseling, and relapse prevention programs, and integration of trauma-informed care for long-term healing. This is important because continuation of care greatly reduces relapse risks and actually strengthen coping strategies. Another very important strategy is providing family support and relationship rebuilding. Strong family connection can actually boost motivation and long-term recovery stability. Key strategies for that is family education programs that address addiction, communication, and boundaries. Also, family therapy and conflict resolution support. Programs for parents reconnecting with children in or regaining custody, and also support for caregivers impacted by substance use. This actually works because families that actually understand addiction can actually provide better support and reduce stigma and also lower judgment or misunderstanding. Another strategy is actually addressing social determinants of health. Recovery is actually harder when basic needs are not met. So then, strategies such as connecting individuals to food assistance, child care, transportation, healthcare, and legal support. Also providing case management that coordinates multiple services or ensuring individuals can easily access resources without navigating silos. This is actually very important because when people's day-to-day stresses are actually reduced, they actually have more emotional and cognitive capacity to focus on their recovery journey. Think about of creating community engagement and leadership opportunities. People in recovery, they thrive when they have purpose and a voice. So encouraging involvement in community service, advocacy, and peer mentorship. Also, creating leadership roles in advisory boards, coalitions, and program design. And also hosting like recovery celebrations, annual walks, or storytelling events. This type of engagements actually reinforce identity, resilience, and belonging, which are protective against relapse as well. So lastly, which I already mentioned earlier, reducing stigma and building a recovery positive culture. You know, Strategies like creating public campaigns, highlighting recovery success histories, uh, normalizing medication of opioid use disorder and prevention practice as part of recovery, and also training community leaders, employers, and service providers on addiction as a chronic medical condition. A stigma-free community actually makes it easier for people to seek and stay in recovery without shame or fear of discrimination. So, in summary, supporting long-term recovery means building systems that actually offer stable housing, provide peer support, create opportunities for meaningful connection, help people find and maintain employment, ensure ongoing clinical care, strengthen families, address basic needs, promote leadership and inclusion, and also reduce stigma and celebrate recovery. So, now, the next part of this presentation, I'm going to focus on practical evidence-based steps that communities can take to combat the opioid crisis. There's also actually there's a lot of evidence-based practice steps in the community. What I selected here was something that I thought was more core fitting for many communities across the U.S. Obviously, there are other evidence-based steps beyond what I'm going to present here, but I just chose some that I find that are very important. The first of them is to form community coalitions, bring together local leaders, healthcare providers, educators, law enforcement, and faith groups, or literally anybody in the community, any stakeholder that can provide specific support to coordinate response to help the community. Also, expand prevention education, implement, school-based programs, public awareness campaigns, and safe prescribing practice. Implementing like grassroots education campaign, like schools, faith groups, and nonprofits working to actually raise awareness. The next one is increase naloxone availability. Distribution of naloxone widely through first responders, schools, libraries, and community centers to actually reverse overdose when, to have it handy when overdoses happen. Also, improve treatment access, support like medication assisted treatment, reduce barriers like prior authorization, and expand telehealth mobile clinics. Uh, Another strategy is reduce stigma, promote language that emphasize recovery, train community members to understand addiction as a medical condition. Also support recovery service, invest in peer recovery networks, transitional housing, and employment programs that stabilize long-term recovery. And very important, track and share data. Use local health data to identify trends, evaluate interventions, and actually adjust strategies. And another very essential strategy is actually engage youth and families, provide mentoring after school programs and family support service to build resilience. Also leveraging faith and civic groups, encouraging like grassroots organizations to provide safe space, counseling, and community support. Improve referral systems, creating referral programs through health and law enforcement agencies, and hosting community mobilization events. That can actually be done in conjunction with like the church, schools, or even the town halls, which actually help put together tools into the hands of every community sector. And leverage settlement funds sustainability, align opioid settlement resources with long-term community resilience strategies. Now, I want to talk a little bit about key grassroots community response. Communities across the U.S. they are actually responding to the opioid epidemic with grassroots solutions that emphasize collaboration, local empowerment, and creative problem solving. And these efforts actually range from community coalitions and legal aid programs to actual entrepreneurship and recovery-focused initiatives. So the key grassroots response are, community coalition, which are local groups forming coalitions that actually bring together health providers, law enforcement, educators, and residents, to coordinate prevention, treatment, and recovery strategies. These coalitions they actually have proven effective in reducing overdose death by tailoring solutions to local needs. Now, legal aid integration. Programs like Opioid Crisis Response Program place like legal fellows directly in affected communities to help people overcome barriers such as housing instability, criminal records, or lack of access of healthcare. By addressing these social determinants, communities actually open pathways to recovery. Now, grassroots entrepreneurship. Um, innovators are actually creating community-based business and services that support recovery, such as peer-run treatment centers, mobile health units, and actually job training programs. These entrepreneurial efforts, they actually democratize innovation and ensure solutions are actually culturally relevant. And also community-led recovery funds. Local fundraising and mutual aid initiatives actually provide direct support for treatment costs, naloxone distribution, and peer mentoring. These funds actually empower communities to act quickly without waiting for top-down policy change. And the last there is like federal support for local action. The support for patients and Communities Reauthorization Act of 2025 has actually been passed by Congress, renewing critical funding for substance use disorder and mental health service through fiscal year 2030. The Support Reauthorization Act of 2025 actually ensures continued federal investment in community-based recovery initiatives, giving grassroots programs the resource to expand and sustain their impact. So why grassroots solutions are important? First, they address root cause of addiction, not just symptoms. Also, they empower communities to design solutions that reflect local realities. And they actually bridge gaps between healthcare, housing, employment, and justice system. And they actually complement federal policy, ensuring sustainability while maintaining local autonomy. Now, there's some challenges and that we all need to consider, not only for grassroots solutions, but for implementing a lot of the initiatives that we talked about, which, these are all things that need to be considered. And, people need to think about solutions or how to deal with it if you face those challenges. One is funding sustainability. The communities, they actually must integrate like grants and settlement funds into long-term plans. A lot of the times communities start implementing programs, because they receive a grant for specific time, but then when that grant ends, the program dies out. So creating a sustainable funding that will continue coming supporting the program once initial funds run out is actually very important. Thinking, ahead. So for what will come, and have a continuing planning in place so that the funding streams will be continually coming, even if from different sources. There's also rural barriers. If you talk about communities, rural communities, transportations and provider shortages make mobile units and telehealth critical. So sometimes, yes, mobile units and telehealth, they're critical, but sometimes there are a lot of barriers that prevent those initiatives to be implemented in rural areas. You need funding for mobile services, and you need cell towers to be available, service availability for people to actually engage in telehealth. Community buy-in, which is very important. Whatever strategy you're going to implement and work with your community, you need to get the community buy-in. Success depends on reducing stigma and ensuring community voice are included. If people are involved, if people are, if they are educated enough so that they can become an asset rather than a barrier for implementing programs, that's a key element for implementing activities to support the opioid crisis. Also, stigma reduction is actually critical. A lot of stigma is something that's still one of the major barriers for accessing substance use treatment in rural areas, and also in non-rural areas, in urban centers. Without changing perceptions, people may actually avoid seeking help. And also, inclusivity is strengthens impact. Ensure that community voice, from everybody, from rural, urban, minority groups, they are all represented in coalitions, so that you actually can have perspective from all angles, from all different types of groups, so that you can actually implement the appropriate strategies that actually will help for your community. Now, I did talk about a lot of different types of strategies. And one would think, okay, so do I have to have all this in my community happening so that we can call ourselves resilient? No, absolutely not. In fact, it's very difficult to find all these components in communities throughout the country. Some communities may be close to have all these components together, but in average, the majority of the communities do not have all these components in place. But all that I talked about here is steps and strategies that you have to think when you start to think about putting a plan in place. So one thing you can do is you can look at this presentation, all the information for these slides, if you want to think about how to implement a program to improve access to service in your community, for instance. You can look through everything that I just talked about here and start doing a needs assessment to see what it is that we have in place. Do a mapping exercise in your community. What services are present? What providers, what stakeholders are present? Who can help us to create the right coalition to start moving the wheels and have services being you can create advocacy to have services being placed. What kind of connections can be created between the partners that are present in the community, and also partners that are not in the community but can be part of the improvement plan from distance. So all this can be thought out, and by having a plan, you actually create, an active plan for your community to start putting things in place. And one thing that I tell everybody is when you think about implementing these types of activities in your community, don't try to implement everything at once. Change comes over time and with small steps. So think about what are the main priorities that your community has. What are the main priorities? What are the low-hanging fruits? What are things that we can put in place that will actually create a motion and that will create encouragement for people to actually improve from there forward? So that's the main strategy. It's not trying to put all these infrastructures and strategies that I talked about all together. Is create movement so that things will fall in place when the appropriate time for them to fall in place comes to. Now, the next slide here is a slide that shows where you can find training and technical assistance if you have questions or if you are looking for a support in implementing several of these different types of programs. There's the Opioid Response Network, which is a locally meaningful education and training that is a program that is actually evidence-based, designed to meet your needs in all at no cost. So this program, you can actually go to this website that is on this slide, and you can actually submit a request for technical assistance in your community. You can also contact the Addiction Technology Transfer Center, and also the Prevention Technology Transfer Center, which are great platforms and have centers in all 10 regions of the country, and each region support the states within that region. And there's also the Telehealth Resource Center, which is an initiative from HRSA that actually have support centers throughout the country that can provide training and technical assistance for organizations and providers who are trying to implement telehealth. So with that, I think that's all I had to say. I'm going to stop sharing my screen, and I'm going to check if there are any questions or anything, or if anybody want to make a comment or bring up something that I did not talk about here that you feel that is important. So please feel free to post a question on the Q&A.
Humberto,
So
do you see the comment slash question in the Q&A?
yes, I'm reading here.
Okay.
Everything spoken on makes sense, describing approach to holistic prevention solutions. I have volunteered extensively with our volunteer harm reduction district in Texas. Our population here is severely impacted by poverty, just an involvement and insufficient available resource for housing income. The root of the social determinants, the root of the social determinants issue is systemic. We have very low federal state investment, very poor health care and education outcomes, and communities have been intentionally destabilized over decades of exploitation. With such a short of resource, it often feels impossible to get our people to support they need. Can you speak on a specific example of how low income and challenged communities that have seen measurable success may implement social this measure? Okay, so what you're describing here is like a community that has, it has uh, low level of resources, and they have a systemic issue in place. So again, that's this is why it's important to create coalitions. You can start small. Okay, so you can create. You need to find a group of individuals or organizations that have a core interest in creating a movement to help to assist this community. And then they start small. They start to get, and then they do a needs assessment, and they do mapping exercise to see what are the assets that are present in the community, and within the assets that they have, what is it that can be uh, expanded. For instance, if they have, do they have a peer support, a group in place? Can they create a peer support in place in the community if they don't have one? So, the key for this is to start small, but I think starting, taking an initiative from the community, having the individuals, creating a coalition and start small and go to their health departments, see what improvements they can, what is it lacking, and then help, maybe contact an organizations that provide support for you to create connections. There are a lot of known government organizations, NGOs, that receive funding from the government to provide support for communities, and they can actually help you to design an action plan for your community. So the whole, the success of making a change is to, again, I talked about this at the end of the presentation, is to start small, making, needs assessment, create a group, and start seeing what it is, what are the low hanging fruits, what can you start with, and then moving from there forward. I don't know if I answer your question or not. So I don't know if they can unmute themselves and speak on what they that she was talking about, he was she was talking about. Did that answer the question?
I'm gonna try to find.
Oh, so she was asking for a specific case study of example, if possible. Um, Well, I don't have on top of my head. I don't have an specific case example from a specific community. But I do know of a case of a community in Appalachian, where it was. But this is a case of a rural community where you know it kind of like the community was in the same state that you described, and you know a lot of people, they had a huge uh, opioid crisis in place. They had it's a very conservative community, and for years, a lot of residents, they struggle with drug addiction, opioid addiction, and at one point, there was a state initiative, which was implemented by the county, and they actually it started with a massive anti-stigma campaign, because there was a stigma was one of the main issues that actually was causing everything not to work, because individuals were afraid to seek help. The providers were struggling. There was also a lack of the providers in the community. They did not have the necessary training for medication of opioid use disorder. The nearest clinic was actually 50 miles away that actually provided substance use treatment. So it was like it was a community that was really struggling. But this initiative from the state that was implemented by the county, what they did was they actually started with a massive anti-stigma campaign and by training providers, and they actually start training students and the parents. They had parent nights in the schools where they were trying to, spread the word. And over time, they even involved the church leader of the community, and the church leaders start talking about, addiction as a chronic condition, and over time the mentality of the people changed and people felt more comfortable to talk openly about substance use. And over time things were changing. It's not perfect yet, but the movement is started, and maybe that's what I don't know exactly the state of this community that you were mentioning there, but I would again, I think starting by looking at touching the low-hanging fruits, which is uh, what are the root cause, what is it causing, the main issue that is preventing the community to move forward. So does anybody have any questions or comments? Maybe somebody has an example we would like to share. Somebody just put it there. Our supply, this largest reason has been active for 10 plus years. We rely on fundraising and grants, but the money available has decreased over the years. We are all volunteers, so our capacity for time and expenditure, gas, drive, whatever, is finite. Local governments and law enforcement has worked against us. We have uh, doubtless helped curb disease transmission, but there are insufficient resources to continue and increase what we can offer. Yes, I can totally understand. Some communities they reach, a very low point where things are not working. And again, uh, you know, when you find yourself in a situation like that, it you need to take a step back and get the right group together, see what is it that we can do, where can we look for funding. Now, every state in the US has just received the CMS Rural Transformation Fund. So I don't know specifically what states are planning, each state is planning for the distribution and investment of those funds, but there's a lot of funding that is now available from now until 2030 to actually create platforms to help rural communities. If this is a rural community, this is one of the I'm talking about rural communities here. So if that the platforms like that exist, so that's why it's important for you to create a coalition and create a recovery ecosystem, plan, a recovery ecosystem active plan. So you need to create what is it that we can do and start small and try to connect with organizations that can provide, even if it's a small support, so that you can start, rebuilding the platforms of support from scratch. You can even start, like I said, uh, an anti-stigma campaign is something that you can work with local schools from your community and involve the students, and they will be beyond happy to help. And I actually have seen this happening, students getting involved in creating campaign, and that's actually it's a very effective strategy, because the message comes from the community to the community. So I think there's more questions coming here. Oops. Let's talk about opioid disorder, fentanyl overdose. 'Cause. So we are talking about opioid use disorder, substance use disorder overall. So, all these strategies are, towards substance use disorder, opioid use disorder. So, yeah, somebody just put it there. We just received funding through opioid settlement funds. I really appreciate this presentation, and I'm taking away some actionable ideas, um, uh, especially regarding working with employers and impact to the community. I think removing the barriers, stigma around stigma and even allowing employees time off to get treatment are important. Yes, absolutely. And again, so what I put in this presentation is just a pool of resources and initiatives. And again, the last slide where you have the links for the training tech assistance, please feel free to look through those resources because you're actually going to have a lot. You're going to have a lot of access to a lot of training, presentations, and support materials for several things that you may want to implement. So all those programs provide that type of assistance. So we're still addressing. Oops, this keeps jumping. The same man and the disorder appear to be a different addiction. So I don't know if I'm following here the discussion here. So I think someone's talking about probably a different addiction other than opioid. Are you talking about methamphetamines or, and again, everything that I just talked about here, it applies for any type of addiction. So it doesn't have to be specific opioid addiction. So when you receive access to this presentation in about a week, or if you have access to this slide, when you get access to the slides, you can use all that information to drive your train of thoughts when you're planning what are some possible strategies that you may want to apply in your community. So.
Well, I don't see any more questions coming in or comments coming in. You got a lot of thank you and praise in the chat, Humberto. So thank you so much for being with us. I did copy and paste the resources and posted them in the chat. I will do that again. They are also at the end of the presentation that Humberto shared. And it is up on the PowerPoint is up on our website. I was able to get that up there for you all. The recording will be posted soon. I will put that in the chat again. And then please, before you go, you will be redirected to a very short survey. So please make sure you fill out that survey. It does go back to our funder and it allows us to continue to provide free trainings to you all. So your feedback is greatly, greatly appreciated. Thank you so much for your time, Umberto, and we look forward to seeing you again on February 3rd. If you all enjoyed this session, please make sure you register for Umberto's next session on February 3rd, addressing the rural communities. So we hope to see you all next week. Thank you.
Thank you all.
Thanks, Umberto.